Case Study 2-1, Displaced Fracture of the Femoral Neck. While walking home from the train station, M.A., a 72-year-old woman with osteoporosis, tripped over a broken curb and fell. In the emergency department, she was assessed for severe pain, swelling, and bruising of her left thigh. A radiograph showed a displaced left femoral neck fracture. M.A. was prepared for surgery and given a preoperative injection of an analgesic to relieve her pain. Intraoperatively, she was given spinal anesthesia and positioned on an operating room table, with her left hip elevated on a small pillow. Intravenous antibiotics were given before the incision. Her left hip in abduction, blood and fluid replacement, physical therapy, and vigilance for development of avascular necrosis and possible dislocation. Case Study 2-2, Introchanteric Fracture. A.R., age 88, slipped on the wet grass and fell while gardening in his backyard. His neighbor was unable to help him to a standing position and called for an ambulance. A.R. had excruciating pain in his right leg, which was externally rotated, slightly shorter than his left leg, and adducted. Preoperative radiographs showed a non-displaced right introchanteric fracture. Intraoperatively, Mr. R. was given spinal anesthesia and positioned on an orthopedic table with his right hip abducted and secured in a traction. He had an open reduction and internal fixation with a compression screw and side plate with screws. His post-operative recovery was unremarkable, although he was at risk for deep vein thrombosis, that is, blood clots in his legs. He was discharged to a rehabilitation facility for several weeks of physical therapy and assistance with activities of daily living, such as personal hygiene, dressing, eating, ambulating, and toileting. For the case study questions, number 1, I put reduction. Number 2, antibiotics. 3, abduction. 4, adduction. 5, the prefix is dis, which means away from, apart, or reverse. Number 6, the prefix is re, which means again. Number 7, the prefix is a, which means without, lack of. Number 8, the prefix is an, which also means without or lack of. Number 9, ortho means straight, normal, correct. Number 10, ex means to remove or out. 11, by means to. 12, un means not, and re means again. For the fill in the blank, number 13, preoperative, 14, intraoperative, and 15, postoperative. Thank you.